who's at risk for diabetes and these complications. So the risk factors, type 1 diabetes, family history of type 1 diabetes would be a risk factor. There's certain autoimmune conditions, and autoimmune conditions are where your body kind of fights itself. Now, one thing about type 1 diabetes is often not related to weight or lifestyle. So you can't really cause type 1 diabetes by eating too much sugar. Type 1 diabetes is really a little more complicated there, right? So it's not as simple as a type 2. If you do have a family history or if you have certain autoimmune conditions, you definitely want to make sure you get screened. Now, one of the things about type 1, and we might talk about this a little next in the next show, is that type 1 typically gives you very significant signs. Like those people are usually really sick. And yet again, most of these folks will manifest their diabetes during their childhood. Now, next is type 2 diabetes. Okay, so what kind of risk factors do you have? Type 2 diabetes, being overweight and obese, especially that weight around your waist. Physical inactivity. So if you're not getting some activity in, and of course, activity, we like for people to get 7,000 to 10,000 steps a day. We like for people to get about 150 minutes of moderate exercise weekly. The less active you are, the more likely you're at risk of developing type 2 diabetes. So you want to make sure you're getting to move around. So like if you're just going to work, you're sitting down all day, then you come home and you sit down on the couch, yeah, you're increasing your risk of type 2 diabetes. The other risk factors for type 2 diabetes, family history, and then there's certain ethnic groups. So being African American, Hispanic, Latino, Native American, Asian American, or Pacific Islanders, all of them, or all of us, I guess, all of us are at risk of developing type 2 diabetes. And age 45 or older was thought to be a risk factor or supposed to be a risk factor, although type 2 is appearing in younger adults. The question is going to be, is that age going to drop down a little bit more? History of gestational diabetes or delivering a baby over 9 pounds kind of increase your risk of type 2 diabetes. People that have high blood pressure, abnormal cholesterol, polycystic ovarian syndrome. So those people would need to be screened for type 2 diabetes, and unhealthy diets can also contribute as well. Then we have gestational diabetes, and the risk factors for that are being overweight or obese before pregnancy, what they call older maternal age, over 25 or 30, a family history of diabetes, prior gestational diabetes or a very large baby, and then belonging to high risk ethnic groups. Yet again, African American, Hispanic, Native American, and certain Asian groups. Okay.